study out that's looking at women who have cancer in one breast who actually are choosing to remove both breasts. And
Yes.
many doctors are quite alarmed about it because when people remove an organ or part of their body for no obvious reason other than fear, it makes one concerned that the best possible judgment isn't being used. And there's a new study that looks at what happens to women who have bilateral mastectomies, removal of both breasts, even if they have cancer only in one breast. And there was a study from Canada that looked at this, and they found actually the complication rate doubled in women who had bilateral mastectomies. There was a 5.8% incidence of wound infection and wound dehiscence. Dehiscence means that where the doctor sews the skin together, it comes apart, falls apart.
Wow.
And that was much, much higher than women who had only single mastectomy for cancer. And of course, this is flies in the face of many of us who spent the last 30 years trying to develop techniques to avoid mastectomy so that women who had breast cancer, or most women who had breast cancer, wouldn't need to have a mastectomy. So the strange paradox is for those of us who have been fighting against mastectomy now to see many women who are choosing electively to remove the healthy breast.
Yeah, it's funny. There's a growing list of celebrities who are doing that. You have Angelina Jolie, who
Well,
just
she's
came
different
out.
now. She's different, and we're going to talk about her later, either this show or the next show. But she has what's called BRCA gene. So her mother died in their mid-50s of breast cancer, and there is an increased risk of breast cancer in women who carry that gene. And women can reduce their incidence of breast cancer by doing what Angelina Jolie did. They don't reduce it to zero, but they do reduce their risk of cancer. I'm talking about women who have no cancer, no genes, basically no risk, and they're removing the breast for maybe a 1% chance that they would eventually, at some point in the future, remove the breast for cancer.
Well, that's just crazy.
So many of us don't exactly understand it, although some women don't want to go through all the emotional turmoil of getting worked up. But again, I'm one who believes you should try to keep your body intact as much as possible. Try to avoid radical surgery unless that's the only option. And doctors are saying that that we need to explain more to certain women that bilateral mastectomy is not a quick fix. It doesn't mean you're done with cancer. You can still get cancer even if you've removed the breast, and you can still have significant complication rates that are higher than in other women.
What do you think what would be the procuring cause? How does a woman is there a certain age she says, "Oh, you know what? I've read too much on the internet." Like, why would someone get the idea in their head to then go ahead and go for some, like you said, radical surgery? It's for such a small percentage. Like, is it the media putting ideas in people's heads, like with these celebrities?
I don't know. I mean, some people fear cancer, and they fear it so much. Maybe they fear cancer more than they fear the risk of cancer more than cancer itself. I don't know. It's not something that I totally understand. I partially understand it. Again, I've been fighting on the other side, the side that says for most women, not every woman, if we remove the lump of cancer and then treat the breast, the woman will have an excellent cosmetic result. Psychologically, most studies have shown that women are intact after that. They recover faster. They don't have the radical scar left over. And they can continue pretty much their normal life. So nothing's perfect for everybody. But again, I came to New York in 1987, a year when at Harvard, about 90% of women chose to have lumpectomy and radiation, whereas in New York, one of the big cancer centers here was doing mastectomies in 97% of women. So the women in Boston and the women in New York are not different, but their doctors had different approaches. And we really spent the last 30 years trying to educate women that breast cancer does not mean the need for mastectomy.
Yes.
Anyway, we're going to take callers. We're at the WOR studio, and the number is 1-800-321-0710. Again, 1-800-321-0710. We're going to go to a word from our sponsor now, and we'll be back in 2 minutes. For new or recurrent cancers, Radiosurgery New York specializes in non-invasive radiosurgery. First in America with body radiosurgery, we have decades of experience. For primary or metastatic, large or small, lung, liver, breast, brain, pancreas, prostate, kidney, bone, adrenal, melanoma, sarcoma, and more, innovative radiosurgery hits the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the pioneers in radiosurgery. We may offer a second chance even if chemo, radiation, or surgery didn't work. Treatment here is outpatient with most insurances, Medicare, Medicaid accepted. Our fresh second opinion could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. We're super convenient, 38th and Broadway in Manhattan. Call 212-CHOICES, 212-CHOICES to hit the cancer.
News Talk Radio 710
WOR.
For new or recurrent cancers, Radiosurgery New York specializes in new, non-invasive cancer treatment choices. First in America, first in New York, first for you, body radiosurgery cancer treatment. Decades of experience with primary and metastatic, large or small cancers. Cancer treatment from head to toe, acoustic neuroma to prostate cancer. We hit the cancer with no cutting, no bleeding. Hi, I'm Dr. Gil Lederman. We're the cancer treatment radiosurgery pioneers, with possibly a second cancer treatment chance for you, even if chemo, radiation, or surgery didn't work. Our cancer treatment is outpatient with most insurances, Medicare, Medicaid accepted. Minutes could change your life. Call me at 212-CHOICES, 212-CHOICES to hit the cancer. Ask us about hyperthermia, too. We're super convenient, 38th and Broadway in Manhattan. Call 212-CHOICES, 212-CHOICES to hit the cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, Rob. Thanks a lot for that. I appreciate that.
Oh, anytime.
So we had a show earlier today, and we had several callers that spoke to me between the shows, and I just wanted to review with our listeners the kind of calls I get. One was a gentleman who was about 50 years old. He had esophageal cancer diagnosed about 3 years ago. The esophagus is the tube between the mouth and the stomach. Early signs of esophageal or gastric cancer are that people have trouble swallowing. Often the food gets stuck in the esophagus or the first part of the stomach. And the usual treatment is a form of chemo, radiation, or surgery. This gentleman had that, and then unfortunately the cancer came back. And right now it's eating through a rib, so it's causing a lot of pain. And he asked about radiosurgery for that and what my experience is. So we spoke about that and what radiosurgery is. Radiosurgery is a non-invasive method that allows us to give a few treatments instead of 20, 30, 40 treatments of radiation, which is what's commonly done. We like to do it in just a few treatments. Why? Because number one, it's more convenient for the patient. Number two, it is more efficacious, meaning it has a higher degree of working. So we do work that's all non-invasive, not claustrophobic. We do computerization of the tumor in relationship to the body and in relationship to a custom-made outside stereotactic frame. And then we send in beams to hit the cancer. And when I say hit the cancer, we're talking about hitting the cancer and not a large part of the body. So that's also very different than standard treatment. and our success rate. Success means we can stop the cancer, shrink the cancer, or in certain cases make the cancer go away where we aim the beam. For esophageal cancer is about 90%. So I told this gentleman that there are treatments available for him. He doesn't have to call it a day, that there's a good chance we can relieve pain and suffering, and a good chance that we can put this particular area of cancer in remission. So that was reassuring for him, as I would imagine most people who hear that news.
Yeah, and for anyone out there, that Dr. Lederman also has some brochures and stuff that you can actually see these machines, these non-claustrophobic machines that you just lay on. It looks very simple. Didn't you say that some of these treatments last just a few minutes, right?
Right. One of the beautiful things, we were the first in America, first in Western Hemisphere to do body radiosurgery, so we have a long experience, and each treatment is less than 15 minutes. We have a caller, Robert. So, here's Robert from Brooklyn. So I want to say hello and welcome to our show.
Thank you very much, Doctor. On this past Friday, I had an appointment with my primary doctor, and usually I run it by him, things that I take nutritionally, and I've been doing nutritional things for close to, 40 years or better. And I take CoQ10, I do the whole nine. But for years, I've abstained from eating red meat, anything with blood. I was juicing. I do CoQ10. I do the whole nine.
Do you have cancer, sir?
No, sir. But what I'm going to ask you,
okay,
then that I took omega-3 fish oils for quite a few years. And so I ran it by my doctors. Now, this report is out now. I think I heard your discussions about the omega-3
right.
fish oils with men with prostate cancer. But my last blood workup, my PSA was perfect.
What number was it, do you remember?
All I know, he said it was perfect. He said it was good.
We should know that. You should get a copy of your PSA and
should
call back and let us know, and we can talk about it. Look, this is one study. It's not the be-all and end-all, and there's been lots of studies that look at fish oil and benefits. So generally, it's more than one study that's going to change the world. So it's something to think about, and it probably shouldn't change your life, but it's something that we should be cognizant of and look at the benefits and the risks of it. And for you in prostate cancer, you look at your age and your PSA, and speak to experts in the field.
77.
77. Well, 77 with a normal PSA, if that's indeed the case, you're probably in pretty good shape.
You know something, I was told that I briefly, I started at 37 years old when I gave up smoking, drinking, eating red meat, a whole bunch of things. And I went into the juicing, nutritional things, and I worked as a professional singer. We was on the road, and none of my guys did anything that was detrimental to their health. For years, I've been doing these things. And
well, that's why you're 77 and in good health. So God bless you, and thank you. Hope to talk to you again soon. So here we are. We had another caller that called in between the shows who had an extensive squamous cancer of the skin around the ankle. And this patient actually had what was thought to be an ulcer of the ankle, and spent years with a different diagnosis than what it truly was, which was a squamous cancer. And he was just seen by doctors on Friday who talked to him about doing amputation of part of his leg for this squamous cancer. And he asked me, is that something that we could treat? And I told him that most probably yes. I told him that most probably we could control or make that cancer go away and keep his leg intact. So he was obviously very frightened about amputation and tearful about it. And I hope that he comes in and gives non-invasive treatment a chance to take care of this cancer rather than radical surgery. Losing the foot is another major part of the body which would alter his life forever.
Wow. Now, I know there's a picture in one of your booklets of someone who had like a squamous cancer behind their ear, correct?
That's right, a massive cancer behind the ear. and it was as big as the ear itself.
Yeah. Can't they? Those can't